Hi, good afternoon.
Good afternoon. Alright, so my name is Chenelle and I'll be your phlebotomist for today. Can you confirm your name for me, please?
Marissa.
Can you spell it?
So beautiful. M-A-R-I-S-S-A. F-R-A-S-C-R.
Okay, your date of birth?
Sorry, 2 December 1998.
Okay. So I see the doctor ordered CBC and kidney function test for you. Do you have your permission to perform this procedure?
Yeah, sure.
Do you have any allergies to latex?
No.
Okay. Okay, so these are the gloves that I'm going to be using to perform this procedure. This is very vital in phlebotomy to help prevent the spread of infections and to protect myself as a phlebotomist. So these are the equipments that I'm going to be using to perform the venipuncture procedure. So first, this is the tourniquet. This is used to restrict blood flow and to help find the vein easier. The doctor orders CBC and kidney function, so these are the two tubes that we're going to be using today. This is non-additive and this is additive with EDTA. This is our alcohol swabs that we'll use to clean the area before we perform the procedure. This is the needle that we'll be using today. And this is the band-aid that we put on this area after the procedure is finished. Okay, so this is the area where I'm going to be performing the procedure. This is called the anti-cubital fossa. So now I'm going to apply the tourniquet, which is going to restrict the blood flow. It's gonna help me to see the vein better. So now I'm going to palpate. So my choice of vein is going to be the median cube. Okay, so now I'm going to swab the area with alcohol swabs to sanitize the area before performing the procedure. Now I'm going to reapply the tourniquet. This is a 23 gauge needle that I'm going to use to perform my venipuncture. It's sterile. I'm now opening in. Now I'm going to let the air out of the needle before I perform the procedure. So now I'm going to perform the venipuncture procedure. So I'm going to turn the skin first, then I'm going to bevel upwards, 30 degrees angle, and enter. Now I'm going to draw the blood into the syringe.
It's bevel.
Apply pressure?
Yeah.
According to the order of draw, I'm going to first put the blood sample into the red tubes that has no additive. Secondly, I'm going to use the lavender tube that has EDTA additive that I'm going to use for the CBC test. To discard the needle into the sharps container. Then I'm going to mix the blood that's in the tube with the additives 10 times. Now I'm checking the patient's arm to see if the clot has formed and make sure it's not bleeding anymore before I apply the Band-Aid. So this is the Band-Aid that I'm going to apply to her arms. So now I'm going to label my tubes with the correct patient's information. Alright, so thank you very much for your cooperation. Your results will be ready in about 2 hours, okay?
Okay, thank you.
Thank you.